disorders. I also use nutrition and yoga therapy along with homeopathy to treat various disorders. Today's speaker is Dr. Rachna Srivastava. She is going to speak about the use of nosodes. She is our National Vice President, as you all know it. And to tell you a bit about her, she is a postgraduate in homeopathy from MUHS Nashik. She has graduated from Harisingh Gour University in Sagar, MP. She has served as a medical officer in National Rural Health Mission and an assistant professor in Jayoti Vidyapeeth Women's University. She's a life member of IIHP, Indian Institute of Homeopathic Physicians, and RSH, that is Research Society of Homeopathy. And she has been actively participating in many national conferences and workshops. Currently, she has her private practice in Lucknow. Her main focus has been her clinical practice of homeopathy. She has written numerous articles in homeopathy for homeopathy in various reputed journals. She is inspired by her father, Dr. U.K. Srivastava, and she herself is a prolific writer, and she serves the homeopathic community by contributing through her writings both in Hindi and in English. So over to you, Dr. Rachna. I think you can begin.
Thank you so much, Alka ma'am, for such a beautiful introduction. A very good evening to all of you, all the respected doctors. First of all, a very happy Women's Day to all you incredible, iconic, inspiring women of our group. So happy Women's Day to all of you. So I think without wasting any time, let us start. Am I audible properly?
Yes. Right.
Yes.
I'll just share my screen.
Yes, ma'am.
Is my screen visible?
Yes.
Yes.
Yes, ma'am.
Very clear.
Okay. So let us begin with the use of nosodes with special reference to Carcinosinum. So nosodes, as we all know that there are so many sources of homeopathic medicines like the vegetable kingdom, the animal kingdom, the mineral kingdom, the nosodes, sarcodes, and the artificial sources, the imponderable sources. So here we are discussing about the nosodes. So homeopathic nosodes are remedies made from diseased animal or human tissues like blood, sweat, urine, feces, pus, etc. And in India, most common homeopathic nosodes that are used are Sorinum, Syphilinum, Medorinum, Carcinosinum, which we will be talking about, Vaselinum, Influenzinum, Variolinum, Morbillinum, Tuberculinum, etc. And there are also some bowel nosodes like Morgan, Gartner, Dysentery, etc. So bowel nosodes are whole lot of different realm to explore. So now how these nosodes are made, as described earlier, they are made from diseased tissues, organisms, cultures or parasites. They are also made from decomposed products from humans or animals, and biological material is identified, separated, quantified, standardized, diluted and then potentized. So then a preparation is made of homeopathic nosodes. Now these homeopathic nosodes are also known as homeopathic vaccines. The other day in our group, a nice discussion regarding vaccines was taking place. It was very nice, and we should be having all these discussions now because it's high time that we talk about all these things. So now what are the uses of nosodes? Basically, nosodes can be used as similimum, like the whole constitutional remedies, then the intercurrents, the complementaries, and also as prophylactics. Like we had seen in COVID, like influenzinum was used by many doctors as prophylactic. Now if we talk about carcinosinum in particular, This medicine was first proved by Forbister and then also by Burnett. So it was originally made from breast cancer tissue, but later on a lot of tissues were explored to make different types of carcinosinums. Like from liver it was made Carcinosinum adenostom, then from the lung cancer Carcinosinum lung, then again a different kind of breast malignancy Carcinosinum breast, then Carcinosinum bowel. So these kind of different preparations of carcinosinums are also used. Now Burnett was the one who used different kinds of preparations, because he was also a prover of different types of preparations. So he used them according to his instinct. किस केस में क्या यूज करना है ये वो अपनी इंस्टिंक्ट के हिसाब से बर्नेट यूज करते थे. Clark used it more frequently than any other nosode as a miasmatic remedy. If we talk about constitutions of this carcinosinum, a special description is given as cafe outlet spots, especially on face or on the back. Now, what are these cafe outlet spots? These are it's a French phrase which means coffee with milk. So, just like you sprinkle coffee powder over milk, exactly some moles etc are sprinkled over the whole body, so it looks like that. So that phrase is used in that sense. So it is kind of blemishes or discoloration on faces or on back. So these are cafe outlet spots which are said that they are the hallmark of carcinosinum. But many doctors have claimed that they don't see such spots, and still carcinosinum is well indicated in their patients. Like Dr. Jonathan Shore has said that he has never seen such spots in many of his patients, yet the patients have improved very nicely. So cafe outlet spots on face or on the back, then numerous moles, and also typical eyes they have said, especially for Forbister, the first prover of the medicine, has said that they have blue sclerotics. The white of the eye, it turns a little bluish taint it gives. So that is the constitution of carcinosinum. And now if we talk about the physical generals, thermals if we talk about, they are warm blooded. However, they are sensitive to both heat and cold. If we talk about the personal history, in such patients excessive parental control is seen. History of excessive parental control, and also after effects of head injury. Prolonged fear or unhappiness, never well since mononucleosis. Glandular fever, this is a very important remedy for glandular fever and infectious mononucleosis. If you see a history of these carcinosinum, you will have to prescribe as an intercurrent or as a constitutional. Then in case of family history, you will see cancers, diabetes mellitus or tuberculosis. So the miasm basically is cancer miasm or all the three miasms, SORA, syphilis and psychosis. Now another indication of carcinosinum is symptoms partially covered by two or more polycrests. You will see that there are two polycrests which are covering the symptoms, but not one is like entirely covering the whole case. So in that case, you are always confused whether it is phosphorus or whether it is arsenicum, and then you are confused. So in such cases, you can prescribe carcinosinum where the two polycrests are covering partially the whole case. Then it is a major remedy, as I said, for glandular fever, mononucleosis and chronic fatigue syndrome. Continuing the physical generals, we will see the desires and aversions of carcinosinum. The desires are butter and fat. Dr. Candigabe has said that they have special desire for butters. They take it in spoonfuls and they eat butter. And chocolate, salt, milk, eggs, fat, meat, fruit. And aversions also, you will see almost the same things written in aversions. So they have a very contradictory kind of picture. Sometimes they might have a desire for something, and the other time they can have aversion to the same thing. So this can occur in the same patients, or you can see in different patients different kinds of desires or aversions. So these are basically actually stages of illness. In certain stages, you will see that they have craving for salt. In the other stage, you will see that they have total aversion to salt. So these are stages, and you will have to see that alteration is always present there. Now we talk about the mental generals. They are extremely sensitive people. They are very sensitive to reprimands, and admonitions aggravate them. They are very, if you criticize them, and especially in front of someone, they will be very sensitive towards that. They are very thin skinned in that sense. They are also very romantic, cheerful kind of people who enjoy thunderstorms, and they like to travel, just like tuberculina. Anticipation, they have a lot of anticipation and also ailments from anticipation. Fastidious, perfectionism is the keynote of Carcinosinum. They are perfectionists. They want to do everything very perfectly, and they have a very strong self control. They have the emotions are very self controlled. They don't display their emotions that easily, and they try to look a very idealistic figure in society. So they are also sympathetic. They have anxiety about others, and they are affectionate. They have love for nature, and they feel responsibility towards environment. These kinds of NGOs, people running these NGOs who are worried about the environment, they are kind of carcinosinum people. If you don't find any other physical symptoms and this only nature love for nature, then you can also think about carcinosinum, because they feel highly responsible, that we are not just responsible for ourselves but also towards the entire planet. We have a certain sense of responsibility. So, and also they have love for animals. They are very kind towards them. They can sometimes they can ignore people, but they will never ignore animals. They are very kind to them, just like Ethusa synapium. Ethusa people are also very kind to animals, and they like to have a lot of pets in houses. So again, responsibility. They have a strong sense of duty and responsibility, not just for themselves but for the entire planet. Now, if you talk about the mentals in case of sick carcinosinum, these were the healthy people. When carcinosinum is healthy, they can be sensitive, romantic, they have a sense of duty, etc. But when they fall sick, mentally, when they fall sick, and then they go into depression, then you see that they become suddenly very closed up. According to Dr. George Vitalkas, they are very vital, social, and expressive people. But once the depression sets in, they are very closed up. They love people, and they're very open and sympathetic and sentimental. But when the depression has come, they don't want anybody to interfere with them. They don't want to talk about it. They don't like any fuss about it. They say, please leave me alone, no consolation. There is consolation aggravation, and I don't want to talk, I don't want to see anybody, I will work it out myself. This kind of attitude they will display when they are sick, especially in case of depressions. Now, this is because they want to overcome the influence of others. They don't want others to influence them in their depression. That's why carcinosinum is in consolation aggravation. So in this way, you can have a differential diagnosis with sepia, because sepia is also like that. They also have consolation aggravation. They don't want to be consoled. The depression will be very deep. It may lead to suicide, just like aurum, but one little light may shine when you put on the music. So also they have music amelioration, just like aurum had, because they are highly sensitive people and romantic, so music will always ameliorate them. Now, if we talk about carcinosinum general modalities, they have aggravations with vaccinations, most importantly, then seashore, sea bathing, short sleep, during storm and thunderstorm. Now, most of the things are mentioned also in aggravations and in ameliorations, because as said earlier, they have a very contradictory personality. Sometimes they have a desire for something, the other time they can have an aversion, complete aversion to that thing. And similarly, we see the same thing in case of modalities. certain things might aggravate and also ameliorate them. Like the seashore might aggravate also them and it might also ameliorate them. So you can see these aggravations and ameliorations. And the most important amelioration, especially in case of children, is lying down and in knee elbow position. They like to lie down in knee elbow position or in the right side. In women, there are a lot of menopausal complaints or hormonal disorders, and especially you will find a history of suppressed or overprotected women, either by parents or by their partners. They are it's a kind of suppression in constitution. And an important differential diagnosis is with Staphysaria, because Staphy also has a suppression in, especially in emotions. So this is a suppression in case of constitution. The whole constitutional will display that suppression. But in Staphy, there is a suppression only related to certain emotions. So this is the differential diagnosis. Now, carcinosinum in case of children. In insomnia in children, carcinosinum is a highly indicated medicine, and also medurinum in insomnia of children. Again, they are very suppressed and overprotected children. They are restless children with tendency to destroy things with destructive outbursts. This is again a differential diagnosis with tuberculinum. They are also very restless and destructive attitude they also have. Disobedience, refusal of parental control, refusal to accept authority. Now this is again a contradictory symptom. Sometimes they have that parental control is suppressing them, and sometimes they are in total refusal of that control. Now these children can have tics and they can bite their nails. Again, lying in knee elbow position, which will ameliorate, or also on the right side they will lie down. They have an afternoon aggravation, and amelioration in the evening is there. Then again, there is strong craving for butter and fat, and they will eat it in spoonfuls. This is the example of knee elbow positions. You can see children, they are lying down in knee elbow position, just like an horse, resting their whole body weight upon the knees and the elbows. Now, carcinosinum keynotes, if we summarize the keynotes according to the pictures, they are overprotected childhood if they have. So you can see that child is sitting in a cage. So this is kind of a symbol where they are overprotected and have a suppressed personality. They might also suffer abuses, sexual abuse or physical abuse in that sense. Then they have great love for animals. They love thunderstorms. They're very sympathetic, gentle, loving and affectionate people. They have desire to salt and chocolates. You can see he's sprinkling salt over chocolate. This is just a symbolic thing that they like salt as well as chocolates. Then another important keynote is the childhood diseases occur late in life. For example, measles, वो 4 या 5 साल की उम्र में होना चाहिए, पर वो होगा 14-15 की उम्र में. It will occur at the age of 14 or 15.
It's not getting scrolled again.
Sorry?
The next slide is not seen.
Is
Yes, now it's seen. Yes, now it's okay.
Okay. Another slide is they have fear of contracting a disease. So you can see that they have, they keep a lot of distance, especially in epidemics, etc. They are very cautious about contracting any illness. But in case of epidemics, it is like normal thing. Everyone is doing that. But even if the epidemics are not there and people are still following certain protocols of that, then you can see that this is uncommon. Then you can think of fear of contracting a disease in a patient. Then they can have frequent complaints of upper or lower respiratory tract. Then there is frequent winking, tics in the face. And I had this patient of frequent winking tics in the face in very early of my career. But that time I was not aware of carcinosinum. I used to give him a lot of medicines. I think I gave him castigum, etc. But nothing was happening. But later on, I realized that maybe carcinosinum was needed at that time. So I had this case, but unfortunately, I could not prescribe carcinosinum that time. Anyways, desire to bite the cuticle they have, and they have chronic coryza, desire to dance, travel, and to read. So just like Dr. George Vithalkas has said, they are very vibrant and very affectionate and loving people and expressive. Again, if we talk about relationships of carcinosinum, so Forbister has given a big list of related remedies. You can see so many remedies are related to carcinosinum. Apart from the nosodes are also highly related to it, like medorinum. It's very difficult to differentiate both the remedies sometimes. Sorinum, tuberculinum. Tuberculinum is also very hard to differentiate sometimes. Now, carcinosinum is an under-prescribed remedy. Dr. Alphonse Guiquens alone did numerous editions in Kent's repertory. Dr. Alphonse Guiquens is one of the best students of Dr. George Vithalkas. He is no more, and he has done a lot of editions in Kent's repertory regarding carcinosinum. He has added this remedy because this was one of the reasons why it was under-prescribed. Whenever you repertorize a case, and carcinosinum will not come because it is not mentioned in the rubrics. So he alone did a lot of editions of carcinosinum in Kent's repertory. After that, it was added in synthetic and synthesis repertories, etc. Now, these people feel a strong connection with the suffering both of individuals and the planet as a whole. As described earlier, they have a strong sense of responsibility towards the society and towards the whole planet. Now, several authors report strong aggravations after this remedy in cancer patients. Forbister also once saw a very strong aggravation with one of these nosodes in a cancer patient, and thereafter said that it was forbidden to prescribe carcinosinum in cancer patients. So initially, Forbister totally forbade this medicine to be used in cancer patients. He said you should not use it because he had a very strong aggravation in his patients. But in his later years of practice, he changed his views, and then he started using carcinosinum. But he only used one carcinosinum. That is, I think, the first one made from the breast cancer. The others he has not recommended or have not used because of their strong aggravations. Now, if we continue with the differential diagnosis of carcinosinum, there is an important remedy, nux vomica, which is a remedy for insomnia, also in case of children. So, the reason why they are sleepless is precisely because they are very attentive to little details. They have an exaggerated love for precision, and also fastidiousness is a very important symptom known to nux vomica. But the differential diagnosis is nux vomica, there are no feelings involved. They are like bosses of companies. They instruct people to do tasks, and they are never pleased. No matter how much you work for them, they are never pleased. So that is a kind of fastidiousness you get to see in nux vomica. But not in carcinosinum. Carcinosinum are like kind of perfectionists involved with them only. They are not fastidious to other people. So he wants to be perfect because of his ambition. Nux vomica wants to be perfect because of his ambition, and he wants to be the best. He is the hard working person more than carcinosinum, who is usually not a hard person. Nux vomica is a very hard person. They will make their employees do a lot of hard work. But carcinosins are very kind in that way. They are not that hard. Now, if we talk about perfectionism, arsenic is there a medicine which with a perfectionist personality. In their clothing, they resemble a little bit. Carcinosinum will resemble a little bit of arsenicum. They have the same love for order and precision. We know that he is fastidious. Arsenicum wants order out of insecurity. When everything is in order, he knows beforehand what is going to happen. That is why arsenicum is very orderly, tidy, and neat. But carcinosinum is perfectionist because of his own responsibility. They feel a sense of responsibility towards everything. Staphysagra is another remedy. I told you before also that they are it is highly related, and sometimes it's very difficult to differentiate between the two because Staffy also have suppressive personalities and suppressive emotions. Okay, because of demanding parents and or partners. Now, in case of pulsatilla, pulsatilla needs a lot of love and approbation of the other person, like pulsatilla. Carcinosinum also needs it. The desire to be perfect in Carcinosinum is because he wants to please his parents, his partner, and so on. Now, another. Sorry?
The slide is not seen.
Is it visible now?
Yes. It's on autumn.
It's on autumn.
Yes. It's seen.
Okay. Later on in life, or very soon as a child, they will have anxiety fits. Very soon in the life of a child, you will notice that they have a very important responsibility. So just like aurum carcinosinum is also very responsible. They are worried about their relatives, their families, their well-being. So in that sense, carcinosinum are very precautious also. Very young children, and they will be highly responsible. And you will notice that responsibility in a very young age. That is the precocity of carcinosinum. So, and when such people, when they get into depression, it is very difficult to get them out of depression because it is a real depression. And just like aurum also, they will have suicidal thoughts, and they are ameliorated by music. Lycopodium is another differential diagnosis because lycopodium also has ailments from anticipation. They fear the failure, they don't want to fail, and so that is why they are highly anticipating things. They become sick anticipating an event because they want to be perfect, and they know that it is not probable that they will be perfect. This is the reason he has the fear of failure, just like lycopodium, and he wants to be perfect and he cannot be perfect. So that is the reason. Another important differential diagnosis is tuberculinum, as said. They also like to travel, they love the exotic foods, they learn different languages, they love to hear music, to read books. So they are also very vibrant kind of people. And it's sometimes very hard to differentiate tuberculinum with carcinosinum. Similarly with medorinum, because a lot of physical generals also match with medorinum. Like they have evening amelioration, they have seaside amelioration, they desire sweet, fat, and fruits. They sleep on abdomen, especially knee elbow position, sleeplessness in children, masturbation in children, recurrent infections from a very young age, loves music, dancing, sympathetic, love for animals, passionate, ailments from anticipation. So a lot of symptoms match with medorinum. But medorinum can be more violent. Carcinosinum are not that violent. They are little introverts and a calm sort of personality they have. And they like to read, and they are fastidious. And they also have a very strong sense of responsibility, which is not seen in medorinum. So there is a chart of relations that I have taken from Absolute Materia Medica by Dr. Ajit Kulkarni and Ishwardas Tarkas. So this you can see that this is highly related to so many remedies. There are so many complementaries to it, and so many medicines that follow it well. So according to this, they have also suggested a trios of medicine, which I have prepared in the form of a chart. This is Carcinosinum trios. If we move anti-clockwise, the first trio you can see is Bryonia, Natramur, and Carcinosinum. The second trio you see is Sepia, Natramur, and Carcinosinum. The third trio is Calcarea Flor, Conium, and Carcinosinum. The fourth one is Arsenic, Lyco, and Carcinosinum. The fifth is natrum carb, strontium carb, and carcinosinum. The sixth is streptococcinum, thuja, and carcinosinum. And the seventh and the last is again bryonia, tuberculinum, and carcinosinum. So these are the trios that are mentioned by some authors, that these are three medicines that will means you can use them one after the other. They follow well each other. So this was about carcinosinum, and it is still a very underused medicine because of the differential diagnosis that you've seen. Sometimes we think about a certain remedy and it is not, and you have to use carcinosinum instead of that. There were a lot of medicines that I still had to use, but it will be very lengthy, so I had not used it. Another important medicine which I have missed is Ignatia. It is also a very medicine which is highly resembles carcinosinum. So, and I also had a case of Ignatia, but I will present it some other time because this will be very lengthy now. So I will present a case of Ignatia women who needed carcinosinum as an intercurrent to be cured completely. So this was about it. This is the bibliography. I have used so many books to consider this. You will have to consider these books if you want to study carcinosinum as a whole. The first is Carcinosinum Drug Picture by D.M. Forbister. The other one is Carcinosinum by Alphonse Guikens, who did a 3-day conference in 1989, I think. Then a whole lot of Materia Medicas that will give you a vast knowledge about carcinosinum. So these are certain books. I have used the pictures of these books also. You can take screenshots, and if you want, you can study them also in encyclopedia. If you have radar, some of these are also given in encyclopedia, so you can read them. But the most important when you have to study carcinosinum is the Carcinosin Drug Picture by D.M. Forbister, who was also one of the earliest provers of this medicine. And the second one is Carcinosinum by Dr. Alphonse Guikens, who did numerous editions in Kent repertory. After this conference, people started using carcinosinum more frequently. So this was all about carcinosinum. Thank you so much for joining. Yes, ma'am, this was all about carcinosinum. I hope I made my points very clear.
Yes, thank you, Dr. Rachna, for the wonderful talk, the wonderful presentation. I am sure all the homeopaths in this group must have received a lot of valuable information in addition to what we usually read. Personally, I have gained a lot, and I look forward to the next session of IWHB. We continue to share our information and our valuable insights related to homeopathy practice. Thank you all for attending, and happy Women's Day to all of you.
There are certain questions. I think some people are raising hands and certain questions.
We'll take the questions now.
I think there was a question regarding the potency. So I think if it is a no-sode, you always have to go for higher potencies. So 200 and above is the best potency, I think. Carcinosinum 200 or 1M you can go up to, not below that. Any other question, if I can?
Anybody would like to ask any questions? Yes, Dr. Rekha Srinivasan.
Good evening, doctors. Wonderful, Dr. Rachna. It was very nice session and very informative.
Thank
and
you.
Book you mentioned was also very helpful. Okay, I will go and search for that. The second one, Forbister. Okay, everyone, most of us know.
Yeah.
And one thing, are you aware of Tynus Smith's remedies?
Tynus Smith's, I've written that in my bibliography. I've mentioned it.
Okay. Cupromet and Carcinosinum.
Yeah.
I have used that very often, But your trios is very good. It's a keepsake, like very nice. Thank you.
Thank you so much,
Thank
ma'am.
you so much.
Thank you, ma'am.
Ma'am, Dr. Himangi Dhake has asked, can we use it as preventive in patients having family history of cancer?
I think we can use if we have family history of cancers, but you also have to look at the personality. If the personality suits the medicine, like they are introverts, delicate, sensitive, then you can use it. But if they have a totally opposite personality, like they're very extroverts and not that calm and fitting to that personality, then of course it will not work. Finally, you have to have that symptom similarity. If the symptom and the constitution matches, you can give. Yes.
Yes, any more questions? So thank you all for attending. I think there are no more questions even in the call messages. So we'll call off the session as of now, and we'll have one more session coming soon. Yes, Dr. Rachna would be declaring what is the topic. If there is any particular topic of interest which you all would like to discuss, please mention it in the group. Yes, we will give priority to that. Thank you so
Yes.
much. Thank you for attending.
Thank you so much again to all the incredible women. Happy Women's Day again, and thank you so much.
Thank you so much, Dr. Rachna ma'am. It was really valuable and I got to learn many things from it. And I hope we'll meet soon with another webinar which is full of knowledge.